Hi, Mr. McDonald. My name's Jenny. I'm going to be your nurse. Dr. Google has written an order for you to have an NG tube put down. Can you repeat your name and date of birth for me, please? Yes, that's correct. I'm going to provide you with tissues and an emesis basin and drape you. To insert the NG tube, what we will need to do is put a little anesthetic up your nostril. That will help decrease any discomfort you might have. Let me check your nostrils and make sure which one we're going to use. I think we'll use the left. I'm going to put some skin prep on your nose. It'll help protect the skin while the tape is on there. Now, the NG tube is going to go into your nostril, and when we get to the back of your throat, I'm going to ask you to drink from a cup and swallow the NG tube right on down. Let me measure it right quick from the nostril to the earlobe to the end of the xiphoid process, and then we mark it either with a marker or a tape flag. I'm going to use a tape flag. There we go. I'm going to lubricate the tube to reduce any discomfort you might have as well. We'll do a good 3 or 4 inches here. Now, let me get my gloves on. I've got my litmus paper at the bedside and my 20 ml syringe. I have a pen light and a tongue blade. At any time you begin to call for gag, we'll stop and check and make sure that the tube is not curling in the back of your throat. I'm going to secure it with about a 4-inch piece of tape, and when we prep those, we tear them to kind of look like a little pair of pants. Okay. Lean your head back. There we go. Now tuck your chin, and I want you to drink from the cup. Swallow, 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 swallow. Keep swallowing. You're doing great. We're almost there. Good job. Now just relax. Breathe in and out through your mouth. I'm just going to loosely tape this so we can get some stomach content here and test it on the litmus paper to make sure that the pH is correct. Now that we know that the pH is correct for stomach content, I'm going to tape it here. This helps to take the drag off of it so it doesn't pull in your nose every time you move. I'm going to hook you up to suction. You should be feeling a little relief. Also, I need to be sure that we don't have the tube pulled up tight against the nostril because we don't want to put any pressure on it. I'm going to hang on here, get you all situated, and we're going to secure the tube so that it doesn't get pulled out in your sleep or when you're moving in the bed. Right here at the shoulder. We keep it at the shoulder so that the Salem sump or the vent doesn't leak. There we go. Now, is there anything else I can do for you before I go? You are in PO while you have the NG tube so that your stomach can rest. Mr. McDonald. My name's Jenny. I'm going to be your nurse today. Dr. Google has written an order to have your NG tube removed. So the first thing I'm going to do is assess your bowel sounds. I want to make sure you have good bowel sounds before we take that tube out. That'll help us prevent from having to reinsert it. It'll take just a minute because I have to listen to all 4 quadrants for at least a minute. Good. Bowel sounds are normal. Let's get you draped and get you some Kleenexes and an emesis basin in case you need them. And I'll have mouth care available once we're through for you. Let me get my gloves on. I know I'm the nurse who put down your NG tube, but I need to verify your name and date of birth before we get started against the order. And that is correct. Thank you. I'm going to turn off your suction and release your NG from the safety pin. I'm going to verify placement with the extra 5 mLs of air that I put in just the syringe just to make sure. Be patient. Good, I can hear it well. Okay. Now I'm going to clear the tubing and then I'm going to untape you. When I tell you, I want you to take a deep breath and hold it while I pull the tube. I'm going to fold this up on itself and take a deep breath and hold it. Thank you. Let's dispose of these things. Give me just a minute to do my hand hygiene. Here you go. Are you feeling okay? Do you feel like you need the emesis basin? Let's get you cleaned up a little there. There we go. Now I'm going to remove all the equipment from your room. I need to take the suction canister down to the dirty utility room and put Drysol in it so that it's not liquid anymore. And I'll note the color, the amount, and the character of that drainage in your chart. Is there anything else I can do for you before I go?